A very good evening, everybody. A warm welcome to all the attendees who've joined with us today. I am Kanishka Verma, President of SGRD SIGN, and I'll be your host for today's exciting session. On behalf of SGRD Student Interest Group in Neurology, I am thrilled to invite you all to the webinar series named Deep Dive. Deep Dive is a flagship webinar series initiated by SGRD SIGN, designed to go beyond conventional academic talks and explore the human journey behind professional excellence. Through this series, we host renowned and distinguished personalities from diverse medical and scientific fields, offering our audience rare insights into their career paths, challenges, decisions, and defining moments. Each session is an in depth conversation that explores not only academic and clinical milestones, but also the resilience, discipline, and mindset behind it. I would like to acknowledge the presence of two very special people without whose support this event could not have been possible, Dr. Saiba Kukreja and Dr. Neha Uppal. Thank you
Thank
for
you.
being here with us today, ma'am.
Thank you, Kanishka.
Thank you.
Good evening, ma'am.
Good evening.
Thank you,
Now,
ma'am. Thank you for being
And
here.
I want to congratulate our president because she has put in a lot of effort to make this possible even in our institute. And she is carrying on the light that we as GRDians actually think of. And she's innovating with new introductions into new introductions of, I would say, incentives, she's exploring a very important area of human body. I would say the brain, and I really congratulate you for this venture.
thank you so,
Congratulations. Yes,
thank you
yes.
so much, ma'am.
Yeah.
Now, I would like to invite Vice President of SGRD SIGN, Harnoor, to please introduce SIGN and SGRD SIGN to all our attendees present here.
Good evening, respected guests, esteemed faculty, and fellow students. I am Harnoor Kaur, Vice President of SGRD SIGN chapter, and it's my privilege to welcome you all to today's webinar. The SGRD SIGN chapter, as part of Global Students Interest Group in Neurology, is dedicated to fostering a deeper interest in neurology and neuroscience among medical students. We take pride in being the first SIGN chapter in Punjab, providing a platform for students to engage with the global academic community. Recently, we initiated a general club where we discussed the topic of epilepsy, allowing us to delve into the latest research and clinical perspectives on this significant neurological condition. We are honored to have Dr. Archith Boloor as our chief guest today. I would also like to extend a warm welcome to our distinguished dignitaries, Dr. Saiba Kukreja, Dean UG, Sri Guru Ramdas Institute of Medical Sciences and Research, Amritsar, and Professor Dr. Neha Uppal, Event Director, SGRD SIGN, whose presence adds great value to this event. I would like to express our sincere gratitude to the American Academy of Neurology for their continued support of initiatives such as SIGN, which play a crucial role in advancing brain health, promoting research, and providing invaluable networking opportunities for students and professionals worldwide. I trust that today's session will be an enriching experience for all. Thank you, and I look forward to the engaging discussion that lie ahead. Over to Kanishka.
Thank you, Harnoor, for the great introduction. Today's webinar is very special because we're not discussing any case or paper. Rather, we have the privilege of hosting Dr. Archith Boloor, sir. Today's session is not just about his achievements, but about the journey behind them. Because life is not just about going through experiences, but growing through them. It is the challenges, the uncertainties in profession like medicine, and the difficult moments that shape who we eventually become. And that is what precisely we're going to be exploring today in today's session. We're truly honored to have you, sir, a renowned clinician, professor, and author, Dr. Archith Boloor. Somebody who has not only treated patients and saved lives, but also guided countless medical students through his teachings. And of course, his famous books without which we cannot survive in clinical postings. Sir has done his undergraduate and postgraduate from KMC Manipal, Bangalore, which is one of the leading institutes in terms of economics and research in Karnataka. He has also earned the Best Teacher Award around 5 times in his short span of first 30 years. He has published 50 plus research articles in international journals like Lancet and Nature, which are high impact journals and renowned across the world. He has also guided many students in ICMR STS project. He has also served as one of the South Asian editors for Washington Manual of Medical Therapeutics. We are truly grateful to have him address our attendees today and share his insights of his journey that shaped him into the amazing clinician that he is today. Thank you so much for being with us today, sir. We are excited to have you addressing our attendees today.
Thank you. Good evening to all. Thanks for maybe inviting me to interact with young minds. It's something good that's happening, that people are interested right in the beginning. When they are maybe in their undergraduate times itself, they are interested in the subject as well as research and the future. So such ventures are something that are essential in this present time, where we connect people from various streams and try to get inputs and try to improve on ourselves. So it's very commendable that the undergraduates from your college are doing this, and I congratulate all of you, and I'm very happy to be part of this session today.
Thank you so much, sir. It's an honor for us to have you as well. So, for beginning with the session, we'll split the session somewhere into 2 parts, wherein we'll talk about your MBBS days, your journey as a student, and then about your books and your co-curricular, sir. So, starting with the very first question, why did you choose to do MBBS? And how was your very first day of your journey? Did the shift from grade 12th to MBBS first year felt enormous and huge?
It's a very standard question asked to all doctors eventually when the juniors would ask for us. I think way back in 1998, that's when I started my MBBS. And so those times, I think we had only 2 major things that we could do. Either we could join MBBS, or possibly we had to change a engineering branch. Possibly that was the 2 things. Now we have a lot more options there. I was not so good at math, so that's something very, very clear. Not bad at math, but I'm not so good at math maybe. So I thought that I would be preferably going to the medicine field, because that's the only 2 options that we had that time. And that's how I think I chose MBBS, and maybe I got a decent rank there and got a seat into a good college there. So that's what the thing. And maybe some of our professors, I think especially I remember very distinctly my professor of botany, Dr. Nagalakshmama. She's Dr. So she used to always say that, yes, you have a pension, so you should do MBBS. Otherwise, I don't think so. I don't come from a family of doctors, so I was not much exposed to the medical field in any ways prior to joining. But yes, the option was limited then, and that's why I chose medicine and joined MBBS. If you look at what the difference from maybe a plus 12, or what we call it as the pre-university that we have, to that, it is enormous. The subject itself is enormous, where you have fixed curriculum till maybe 12. And then when you come on to MBBS, you have a real, there is no limit for what is the curriculum is. There are so many subjects, and there are so many, the ways that we can read it. There are hundreds of books that are there. So it's enormous. And the most important part is, here we are not dealing with the practicals. Is not like you're doing with machines or you're doing with the chemicals. You're dealing with patients. So that's a big difference that has come. So it's a huge jump, when you join in your first year MBBS, and then you go to the dissection hall and you see the cadavers there, right? It's something very quite different. Not everybody is exposed to that. And that's something very, you come to this glowing truth that you're going to deal with the patients. And if you don't do things right, then the patients can die, they are in your hands there. So, instantaneously it gives you that responsibility that whatever you do, good or bad, there is going to be a effect of it. So either a good effect or a bad effect, and that can cost, it can cause serious untoward things that could happen. So a sense of responsibility does begin right from there. And as we said, the subject is enormous. There are so many things that we have to learn, but then that's a part of it. Maybe other curriculums are also like that. Maybe engineering also has so many things, but the key difference is where we are dealing with lives, and then our actions would determine somebody's life. So that's something, the revelation that would come to you, maybe in your first year or your second year when you're exposed to your clinics and you go and see the patients. That's when you get it, and that's a huge difference that comes, and that's what defines your possibly the entire journey onwards. Is that first time that you interact with the patient and possibly speak to him. That's where your career or your life as a doctor begins. So that's quite different. So not everybody is privileged to have that. As MBBS graduates, we have that additional privilege that we do for our lifetimes. We are related to patients.
Yes, sir. So the next question, during your MBBS days, what kind of student were you? The disciplined planner, the last minute warrior, or somewhere in between?
Most of the time, I think a disciplined planner, because I think our times, many of us would be like that. You would be there in time, you would do all things proper, your records would be up to date. We don't keep it at the last moment. The teachers were very tough those times. It was not as easy as now. We had much, more stricter professors who were there. So it was, we had to be on our toes. But yes, not that everything can be done, disciplined. However disciplined you are, you would have certain things pending for the end. So when the exam comes, there is always a last minute thing that's going to happen. But predominantly, I would consider myself to be, more of a disciplined person rather than a last minute preparer. That's what I would think I was.
Great, sir. Which subject during MBBS challenged you the most, both emotionally and academically?
I think MBBS, so many subjects, we had the same subjects. Luckily, it's not increased now. It's the same thing that we were, but we had more, maybe more difficult things. Maybe we didn't have books which were so refined. We didn't have Indian author books, practically none those days. It was all the foreign author books. Very, very complicated things were there, and they expected us to know quite a lot of intricacies of the subjects. If I look at the first year subjects, possibly anatomy was difficult because we had to remember a lot of reality things in the lateral medial, the attachments, all those things. Though when you correlate later, possibly it becomes easier. But in the initial part, anatomy had a lot of things to remember there. And I don't think so it was actually, I mean, I won't label it as difficult. On retrospect, it is quite important what we did there. And when we correlate it with clinical, pharmacology was tough because there were so many drugs to remember. Pathology, micro and all was good. Pharmacology, we had a lot of classifications, drugs and all those things, maybe. So if I had to choose a subject which was a little difficult, maybe I would choose Pharmac, maybe. But I won't say it as it was actually difficult. It's much more bigger now. The number of drugs that you fellows are reading now is maybe at least double of what we used to read. So, but that was maybe a little difficult for me. Otherwise, clinical subjects, I did not have that much of issue compared to these subjects which were there.
Great, sir. So the next question, what is that one habit of yours during your student days that you still follow? And even the experience that you have in context of it?
As a habit, I think something that is very, very important as anybody in the field of medicine is discipline. That means you have to follow it. I wouldn't say it is just about the time that you take, the timing that you have to follow. You have to be punctual. I'm not saying only in that term. It's the discipline in whatever you're doing. So if you're studying, you have to give your full attention towards that. You have to just not do it for the sake of maybe finishing a chapter, understanding a chapter, or by hearting something. So the discipline is important in that way, that we have to understand it in a way that it should remain with us. Similar to that is our actions. You have to be in time. You have to be, spending proper time to each of the activities that you are engaged to. If you are, studying, if you are taking a class, if you are maybe even you take extracurricular, there should be a fixed time for that. So discipline is important. And that's one thing that I think I have maintained right from my MBBS time to now. I'm absolutely punctual. That's something which I go by that. So I don't like going to any place later than the time what is there. I'm generally earlier than that. That's what I've maintained. Be it the college, be it the classes, be it any of the lectures, be it even patient seeing, I would be earlier than that. If I am late, I feel very worried. I feel very uncomfortable going to any place where I'm supposed to be at a time and then I go late. So that's something which is continued, and that is a part of the entire discipline. I won't say going in time is discipline alone. Discipline is this is a way that you're following discipline. So that's something that you have to maintain.
Especially, so yes, talking about punctuality, something that we Gen Z need to inculcate in us, something which is missing.
Yeah, that's true. Our days was difficult. Maybe in those days we had to travel distances. We had to, we had to travel distances and then reach places. Maybe so much of, automobiles, etc. were not there. And communication was difficult. We didn't have phones. Phones came only when we were possibly in the internship or the PG. So anything communication was physical communication. You had to go and tell that things. You couldn't send a message or something like that. So we were like, for anything that we had to do it. We had to take more time to do that. So that's what is important. So even if things have changed now, you can call anybody at any time, but still, I think you have to maintain that discipline for that.
Yes, sir. So the next question, what was the very first moment when medicine stopped being an idea and started feeling more like a calling to you?
So that's, I think, the first clinical posting itself. I think we were very junior. I think in the third semester. That's the second year, part one. I think my first posting was medicine itself, and that's when we have a government hospital attached, which is overflowing with patients. When you go, you find patients on the floor beds, and then people doing a lot of procedures, intercostal drainage or resuscitating patients in the ward. Those days it was not as developed as now. So that's when we go there and we see that a person can do changes in life. If you have a patient with breathlessness and a pneumothorax or a massive pleural effusion, and you put an intercostal tube drainage, the patient becomes better. The feeling of bettering. That's something that it's very, 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 very gratifying in ways. So seeing something like that, maybe somewhere in a group of 25 or 30, you're standing the last there, and still you can see that that makes it means that you are going to do that eventually, and then that's a so-called power that you have, and that's when we realize that yes, this is what we are meant for. So that's when I think so. So the first clinical exposure, that's when you think that actually being a doctor means more than just getting the degree. It's more than much more than that.
Right, sir. So the next one, what was the most intellectually painful phase of your life? MBBS or MD? The phase that almost made you question whether you truly belonged here or not.
Uh, Maybe I don't think so. I would, either of the phases. I think both of the phases were good enough because I was interested in that, possibly. MDS was more difficult compared to an MBBS because MBBS we are, just students there. Do not have any responsibility on your own there. As a PG, a postgraduate, you are the one who are taking care of the patients. You are the first to see the patient. You're the first to, identify any abnormality. You are the one who are to take the call and proceed further. So the post-graduation time possibly is a little more difficult compared to an undergraduation time, but I would not call it as actually difficult in that way. It is a learning that everybody who goes through this has to go through that way. So as a postgraduate, I think you would be in a position where you are having more responsibilities compared to an MBBS where you're just a student, you observe possibly. So post-graduation gives you that actual opportunity to know whether what do you want to do in future. Do you want to stop it? You do want to explore more branches. You want to specialize. All those things comes during post-graduation. So post-graduation is definitely a more difficult phase, but yes, if you're interested in the subject and you're taken up the subject that way, I think that's obviously fine. So everybody has to go through the 3 years of whatever it is, and then that's how the course is like. You take an interest and then you choose your subject. So that's how it is going to be.
Yes, sir. So, sir, talking about us, we're really very worried about our marks. How much do we score? Whether it's finals or it's terminal exams. Looking back at your journey, what mattered to you more, marks or the knowledge that you acquired?
Retrospectively, now I can say it is knowledge, but then the true and true, it's marks which is important there. You have to qualify, you have to move forwards. Everything is based on marks. So I won't say that marks is not important, but yes, finally, it's the knowledge that's important. In a retrospect, you would have, many gold medals and you would have got real too many marks there. But finally, it's the persons who have worked with the patients, who have, actually had your hands on. They are the ones who are successful. I won't say that the toppers of the batch are not successful. The toppers of the batch are definitely successful, but then you have a large number of people who were, just there. They were doing their work well, and they are doing really well in the long run. When you see the long run, they do really well also. So marks are important, definitely. I wouldn't say that marks is how you assess now. The system is like that it is important, but more important than marks is the learning that is there. Many times we end up going through all these crash courses. You have a lot of tutorials that are there, and micro notes, not even the textbooks. People read just the question, not even the question and answer. They would read only what is supposed to be written in the exam, and then you have a huge MCQ burden that comes, which doesn't touch the depth of knowledge. It only checks quite a large amount of recall that's there. So that's important because the system is like that, so you have to follow it like that. But in the long run, when you're practicing, it's your experience that matters. It's how you do it well. You might be the best of the 100 marks in surgery, but then your surgical skill is not getting tested in your exams at all. Surgical skill is how you treat your patient, how well your patient gets cured. You might know the entire of medicine, but then if you're not able to diagnose a patient which has come to you, that's going to be a loss in your life. So it's the experience, and that comes only, there is no alternative for that. You have to practice, practice, and practice, and that comes from age. So we cannot expect a undergraduate student to have the experience. That comes only by age, that each of the student would develop. For at the MBBS level, a sincere effort to get marks and to understand possibly the subject as a whole is more important.
Right, sir. So, sir, a weird question. If you get a chance to choose your PG branch again, would you still choose medicine?
That's a question, I think, which everybody expects me to tell, that I would choose medicine at any time. Obviously, now I should say that, but then actually the field which I wanted was surgery. So I wanted to do surgery. Till the end, I wanted to do surgery. So I was quite good at surgery as a subject, as well as maybe during my internship also, I had good units where I was posted, and I was quite good with maybe the hands-on part of it. But what happened was, maybe I've told it in many other forums also, that I have fine tremors in my hand. Okay, it's not there now, but those days I could, maybe I had asthma those days, and now it's much controlled. So maybe it was due to the inhalers that I was using, but then there was fine tremors in the hand. So I think just around a week prior to our counseling, that's when I thought actually whether this tremors would hamper my surgical skills. So that's what the only point which came into my mind, and I said no, I would not want to do a field where I will not be able to do the surgery. Immediately I decided I would have got surgery anytime, because medicine goes really fast. I would have got surgery, but then on retrospect, maybe now it's 18 years, 20 years nearly, my tremors are not there. So maybe I did a wrong decision that time, but I'm happy with medicine. If I had to choose again, I would choose medicine. That's what I would say, because I don't know whether surgery is still a fascinating thing. That's where you can cure things. You can remove a tumor, you can remove something, and the patient becomes fine. Medicine is more of diagnosis and controlling things. There's no cure as such. Maybe some diseases you can cure, but surgery is a curative disease. So it's a fascinating field. It requires more of your skill, as well as your time, emergencies, etc. Medicine in that matter, maybe you can, but yeah, knowledge of medicine is much more than surgery. They used to say that surgeon should be a good physician who knows how to cut, but that was the old generation surgeons who knew everything in medicine. Presently, surgeons are predominantly about the skill that they acquire, and there's so much of advancement in surgery now. Maybe I may, on hindsight, think that I could still do a surgery as a branch. But on the first preference, medicine. I think what I've learned in medicine and I've seen medicine, I think I would choose medicine.
It's really rare to see somebody like you, sir, who's the best at both medicine and surgery. So what we
I don't
actually
know whether I would have been best at surgery, but then I was good at those days. Okay.
probably you would be, sir, because as of now, what we feel it's either you choose surgery or medicine, right? But you've
That's
been the
true.
one who's the best at both. So, so the next question, sir. You have published around 50 papers and guided many students in their ICMR journey. How would you look at your research journey during your MBBS days?
I think that's something that I am thankful to my institution, Kasturba Medical College, Bangalore. I think from the year 1999, I think I joined in 1998, 1999 onwards, undergraduate research came into our institution. We had good impetus given. Faculty were so much interested in student researches. And in the community medicine, that's the third year, we had a compulsory project that had to be done. We had to go to the community, select a choice of a topic, and we had to write the research. We had to do the research in 3 months and then get the data, statistical analysis, and we had to, make a book out of it, like what we do a thesis in a PG. We had to do it in undergraduate time, and it was mandatory, though it was not there in many of the universities. It was mandatory, and I don't think so. Publication things started those times. So I'm talking about early 2000s. People used to publish that time, so there were quite a lot of good faculty who used to publish. But undergraduate publications started possibly in 2007 onwards, where the same thing came into the vogue that undergraduate topics also would get published, and people started. In our times also, people used to go to USMLE and PLAB, etc. And there, the weightage that was given for publications was higher compared to possibly Indian institutions. That's where the undergraduate research came into huge vogue there. And, we had research clubs which were there in the college. We have a big one now. You have a SRF, that's there, Student Research Forum, which does national level conferences for the past 5, 6 years now. So research was there, and undergraduate research was very much encouraged. And yes, we undergraduates, we have them maybe from the second year to the final year. You have almost 3 years with them. So you can do a good research topic, something like a postgraduate. Postgraduates are also going to be with you for 3 years. So the same topics, you do have a good amount of interested undergraduates who are there. And, when they talk about postgraduate, it's mandatory. You're supposed to do a thesis. But when an undergraduate wants to do a study or a research, it's more of interest. So, and it is more evident that, yeah, when a undergraduate does, they are pretty naive to the subject in the way. So the data that comes out of it is probably more genuine than possibly somebody who is already into, post graduation, where that this is how the results have to come. You would tend to have a little bias there. As an undergraduate, you will have lesser biases, and opportunities are there. You have places, you have patients all over, you have clinical subjects, you have the paraclinical, pathology, or forensic, etc. But there's a lot of scope for research for undergraduates. So that's something which is very, very important that we should inculcate. Maybe our times it was not so much mandatory that we should have research publications and all. I started only, maybe my first publication came only in 2008. And as of now, I have almost around 90 plus publications. But our students, I'm just saying in the last 6 to 7 years, if I say from 2015 onwards, a lot of undergraduates, I know of undergraduates who have, before they finish their course, they have 5 to 6 publications. It's good. That's something very, very good. So you can start with small things, maybe publishing some case reports, and then possibly you can do a small topics and research, or you can, have some write-ups about topics, reviews, etc. So people are interested. The avenues, the patient loads, etc., are there in most of the part. You just require a guidance. You require, some fine tuning of the skills. How do you do it? And definitely you require guidance from your faculty, and that would help it. Undergraduate research is increasing to a great extent, and you have a lot of grants for that, the ICMR or the other that's coming up. So that's something that is very, very important. That's how the future will be.
Right, sir. So, talking about research only, what do you think, sir, is the biggest misconception that students usually have about research? Something that they should probably unlearn immediately.
So something that's there, that's what. No, we are happy to do things that we are, assessed for. We have an assessment of it. And research is not compulsory. If research were compulsory and you had marks for that, everybody would have come into the fray. But then you can't force. Research cannot be done like that. You should do this much research. Research has to be from inside. That's there. And something that you should always remember, you might achieve many things. You might, do hundreds of surgeries. You might do the most complicated surgeries. But unless that is published, unless it is acknowledged, it's published in a particular literature, you cannot say. People might think, oh, he's just saying that. So you should remember that a publication has so much of weightage, and that gives you a lot of leverage in many forums, the academic forums or your institutions. The researchers are always respected. So it is important to understand that research is, it's a part of it. You cannot, each day we would see a lot of things. You would see a rare sign, you would see a rare complication of the drug. Only if you report it, that becomes, guideline for the future. So otherwise it's just anecdotal. You see somebody and follow somebody, it passes on by mouth to mouth unless it is published. If it is published, it goes to the general world and the general world can learn from it. And medicine is always about learning and unlearning. There is nothing hardcore dogma in medicine that is there. What was in the past is not in the present. So things have changed. The same thing that we tell in the past is not true now. So our experience with whatever, be it a patient, be it a scenario, be it a lab report, it has to be published so that it goes out to the world and everybody learns. So that's a responsibility more than a work that we do. So research has to come as a responsibility rather than a burden. And undergraduates also should understand that, yes, it has a severe weightage for in your CV, research looks really good. So that's one thing that maybe you can, get the undergraduates to. But later it is the interest that is needed.
Yeah, yes, sir. So, sir, based on your experience, what does medicine demand from you that no exam ever tests?
As for the exam part of you are asking, or it's in general?
In general.
So I think that's what it's. Everybody will pass. You have your exams, you write your theory, your practicals, etc. What is important for us to understand, which I always underscore, is we are patient centric. We are not centric around a book. Just because the book says that this is how it is. Our entire, whatever we do, however we act, however we treat, however we operate, it's all patient centric. So that's a cornerstone that is there. So the patients are the ones who teach us the maximum. The patients are the ones who are going to tell you what is right, what is wrong, your mistakes, everything comes there. And the most important part that is, attached to us, which is not there possibly in an exam, is the interaction that we do with life. You are responsible as well as, your actions can be responsible for lives and deaths that's there. So that is something which is absolutely unique in our, field, as for studies as well as for profession. The interaction with the patient, interaction with life, you deliver kids and then you have also a role to do when somebody is critically ill and you do some things and then save the patient's life. So that's something very, very crucial that we have, which, is unique to our profession. Nobody else can do that.
Right, sir. So, the next question, sir. What uncomfortable truths about medicine should every first year student know? Something which is rarely said out loud.
Okay, so medicine is never ending. It's nothing like a fixed portion that's there. So that's something that you should remember. Just because you read this many hours a day, or you finish reading this book n number of times, that's not the end of the medicine. Medicine is ever growing. So as a practicing person of medicine, whichever field you have doing it later, you are a lifelong learner. So there is every day you learn things and you unlearn things. What was in the past is not there in the present, and there are newer and newer things coming. The number of advances that are happening in the field of pharmacology or intervention that's happening is enormous, for the patient care that's happening. So it's always learning. You can't stay static. You will, you'll just wither away if you just do not keep up to date. So something that is very important that every student should learn, should understand in the first year itself, is medicine is lifelong. So you are going to learn It's not about you are going to teach, you are going to this. Even if you're a teacher, even if you're a professor somewhere, you will be learning every day. And that's something that you should always remember. And never keep the dogmas of medicine. What is true today may be false tomorrow. So always keep your mind open and be aware of things. There is so much of avenues where you can learn from, and there are many avenues where you can learn wrong things. People, the social media is so much that they can say the wrong things also. So you have to be very much conscious to understand what is right and what is wrong before you say.
Very rightly said, sir. So, second last question. When contributing to a global resource like Washington Manual, what standards of thinking and precision are non negotiable? And how can students train themselves to meet that level?
Okay. So I think it's high time these international, books came into our, our South Asian or maybe Indian editions. Now, what is different from theirs? The patient, the disease remains the same. It is how they manage there. There are protocolized management that happens in the West, where in India we have so much of a disease burden, so much of population, be it India or China or the entire Asia. Possibly it is difficult to do what it is done there. So, and a large amount of the population might be having resource remitting, which is not the case in the West. So, what is important for us is to Indianize things. Though we have the maximum, be it diabetes, be it cancers, be it any disease we are saying, we have the maximum patient base that is there. So the knowledge that our professors or our seniors have in managing these cases is it's just enormous. People who write books in the West, possibly they would have hardly seen a single case of a disease and they would have written a full chapter on that. Where here our doctors would see that disease every day and they would know how the disease would manifest and what complications could happen and how do we manage, but never we document. So that's something very, there is a mismatch that is seen there between the West and us. So when you get into, possibly editing, like I had the privilege of editing South Asian edition of the Washington Manual, 2 editions. So what I tried to bring about is this overlay. What is there? It's very much protocolized. It's absolutely how it has to be done. That's how the textbooks there is mentioned. Now, but then there is an Indian edition, Indian version or the South Asian version. The diseases are different. We see a lot of different infectious diseases, and the way the patients behave is also little different. So, so our overview onto that has to be, possibly amalgamated in some way. West is absolutely perfect when you say the protocols are there. So anybody following the protocol will never make a mistake. Even if you are doing it or somebody else is doing, you follow a particular protocol to manage a disease. That is how it's to be. We also have to do that. But then, yes, the burden that we have is sometimes difficult for us to do everything by the protocol. We end up mixing or missing certain steps. So if you follow their protocols in the same way, I think we are at par with them. And with the number of patients that we see, we are much, much better than what our colleagues in the West are.
Perfectly described, sir. So, as we move to our last question, so when your career is eventually looked back upon, what would you want it to stand for? Something beyond books, papers, and titles.
I don't know. It's quite early, I think. I believe to say anything, but I look backwards. I think I would like to be remembered as somebody who taught you something, not only as a subject, but for life. So if ever somebody has interacted with me, they would definitely take a lot of subject with them. And possibly they would learn something of life also from me. And something that I always, why did I start writing books and thing, is I have had the privilege of having good teachers in the past, and then they have taught me things. And there are, those days, if a question is asked, we had to search through multiple books and then find an answer. There was not much of internet and all those days. We had to go to the library, search books, and find out the answers. And the main intention of mine writing a book would be whatever I have learned through whatever ways I have got it, should be passed away to others. So when I've written a book, it's not only the students whom I directly teach, this book goes to the world, this book goes to everywhere. So it remains with everybody. So if at all I would like to be remembered, possibly a teacher who taught everybody. That's what. Life as well as medicine.
Rightly said, sir. So, before we open the panel for our attendees to ask questions, we would like to have a rapid fire round with you, sir.
Okay.
So, the first question, morning person or night owl?
Definitely morning person. I wake up early.
First advice you ever got as a student?
First advice, I think
First and best
continue.
advice.
First and best of, yeah, just continue. Don't stop. That's something somebody told you. Sometimes you feel a little low and all, nothing. It changes.
Right.
Life will change. You continue. That's what perseverance, what you could
Yeah.
call. Just remain there.
Great, sir. Indian author books or foreign author?
Definitely Indian author. Not because I am writing it, but then the perspective is different. Indian the diseases, the way we look at it's quite different.
Right.
Definitely, you should read foreign authors, but the Indianized versions are definitely what is required for us.
Right, sir. Biggest misconception about doctors?
Something that I think, okay, that maybe doctors know it all. No, we don't know
Right.
much. We also are learning. So there are many times we do make mistakes. We learn from that. And doctors are also humans. We do make mistakes. So
Rightly said,
we
sir.
don't know everything. Yeah.
Yeah. What's tougher, exams or clinical reality?
Definitely clinical reality. You are every day you think has to happen in this way and it totally changes on your own. So it's clinical reality. Definitely difficult. It
Right,
is.
sir. Tea or a coffee person?
I like both, but then not. I would not label myself as a tea or a coffee person. I have no problems with either of it. Not that
Right.
I take a lot of tea, not to take a coffee. I'm okay with both.
Right, sir. Worst professional fear that you overcame?
That's something I think, yeah, many times, when you're in the initial part of your PG life or an interns, you would see deaths.
Yeah.
You would see deaths and you start blaming that I could have done this. That's why this patient died. That happens many a times. You're generally helpless, many a times, your patient would die in front of you. You would have done some treatment and it doesn't. And then you start believing, oh, no, this is how it's going to happen. So the truth of medicine is that you are not the one who are responsible. You're just around there. You're supposed to do your activities, whatever you can do it in your best way. You're not responsible for death or life. That is something that we should remember. And just because the same scenario comes back in your future does not mean that the patient would die. That's something that you should always remember. Uh, that death is not in your hands.
Aptly
Neither
said.
is life. Neither is life.
Single best way to stay motivated?
Single best state motivate. I think that's what I told you. Go on. That's something that
Go
you have to
on.
remember.
Right,
Just
sir.
have your perseverance. Just remain that there is going to be change. Be part of the change.
Right, sir. One word that describes the medical culture?
Medical culture as a whole.
Yep, as a
Uh,
whole.
as a whole, that's I think the word which I would like you to. I mean, I would like it to be described as humane, but that's what is quite far away from what is happening now. But then I think that would be the ideal word. Should be remembered as humane. But otherwise, I think a lifelong learner would be a better word. We learn. We continue
Great,
to
sir.
learn.
Your favorite non-medical hobby?
Movies, movies, movies,
Movies.
only movies. So movies, and now maybe the web series, but movies.
Great, sir. Great to hear it coming from somebody who's considered too much like professional.
I
Because
see. I see more movies. I see more movies than I read. That I can tell you. I see movie practically every day.
great, sir. Well, because usually this is the misconception that we have, right? You either study or you enjoy.
That doesn't happen. That's not usually like that. We have a very small percentage of people who are the so-called only study. They also have some good things in them, but majority of us have a balance in that. I don't think so. It cannot be. We are humans.
Right, sir. Most impactful book you read outside medicine?
Most impactful book. Okay. I think there's a book. I think it was gifted to me by my students called as Tuesdays with Muri. I think
Okay,
it's a movie made on that also. It's about a teacher. It's about a teacher and how he. It's really good. So something that I would always wish to become something like that. Tuesdays with Moody.
great, sir. One thing students undervalue.
Time. They think there is no time for everything, but
Right,
then
sir.
they end up wasting a lot of time. So time is precious. We have 24 hours in a day. We have a lot of things to be done in those 24 hours in a day. And these 24 hours are all, they are worth, you can do anything in those 24 hours. So time has to be valued. Time gone cannot be recalled back. So you can do everything in present. Forget about what's happened in the past. Yes, keep an eye for the future, but live in the present, respect the time, and value the time. Time is something that we should always respect.
Right, sir. A superpower that every doctor needs.
Superpower that every doctor needs is compassion. That's something
Compassion.
that should be with us. We should be. I think anybody who's not compassionate should not come into our field. It's not a superpower. It's just a human, quality that's there. It's nothing, but that's the most important thing. Many of the diseases we can't do much. We just, they are just progressive, be it malignancies, be it degenerative diseases, large chunk of diseases. And what keeps things going is compassion. So you should have it. Definitely, it's a virtue which we are all born with. We have to make sure that that comes out well. During our MBBS time itself, we should inculcate in certain things which can get the compassion out of it. We should try that very, very, very evidently.
Right, sir. So the last question. If medical college was a movie, which genre would you give it?
So I think it has everything of it, be it other than maybe a thriller or a murder mystery. Other than that, I think every genre, be it comedy, be it romance, you would see some things happening every time. Maybe Shah Rukh Khan movie that would be there, and a lot of dialogues which would say that if it's not fine at the end, it's not the end.
Right, sir.
That's what would be there. So medicine is always has that positiveness that we have to remember that it will fall out to be normal at the end. And yes, if you do your work sincerely enough, the world would make sure it gets to you. It helps you through that. So I
Rightly
think a
said,
Shah
sir.
Rukh Khan dialogue for that. Yeah.
Yeah. So with that, we wrap up the questions and the rapid fire round. So now I would like our attendees to please unmute themselves if they have any questions for sir. The panel is open now. Okay, so we'll take first question from Harnoor.
Good evening, sir. Thank you
Good
for
evening.
valuable insights. Since most of our participants belong to the first and second professional years, what opportunities would you advise them to pursue during these early years, sir?
I think the most important thing that you have to remember that these subjects, though it might you might think that it is very much theoretical part of it. This forms the basis of what you're going to do in the future, be it the clinical medicine, be it the surgical branches, be it obs gynae or pediatrics, whichever it is. These basic subjects, be it the anatomy, the physiology, the pathology, the pharmacology, and microbiology, all these are absolutely building blocks for your future. If you give good attempt to on these, you understand this, the altered physiologies and the pharmacology, that's all it's medicine. There's nothing more in medicine. You have a physiology that is there, which is altered, and then you have a disease, organism, whatever, and the drug that we treat. So your understanding of these basic subjects is absolutely important. People have told us also in our times, but none of us listened to that much. On retrospect, we always feel that we should have given more importance for these subjects. So please remember, do not, I know people are all behind your NEET, PG, etc. You start your coaching, even in the first year, you would miss on your classes and you go for coaching and then you do the multiple choice questions and all. Do that, but do it in a very small ways. You have to finish 4 years. You have to finish 5.5 years. Only then you can apply for your NEET PG. You can't do it in first year. So go on a small pace. Make sure that you do your subjects well. Give good importance to all these subjects, like the subjects. And whenever you go to the wards, learn from the patient. That's very important. Speak to patients. They will teach you a lot more than books. So that's something that you should always remember.
Thank you, sir.
Thank
Thank
you.
you.
Let's take the next question from Ashmeet.
Good evening, sir. I wanted to ask, how did you find the time to balance extracurriculars and academics side by side during the college life?
Okay, so that's important. That's what maybe I was more into cultural parts of it rather than the sports part of it. I would go and observe sports, but then not participate actually. Culturals, we were a huge part. So we require to know what we want to do, how much of time we have in our hand, Many times you have certain cultural fests and all where you will have to stay day and night, do that only. Academics would go back that time. So you will have to, you will have to recapitulate it in later times there. So always timing is very important. So many things you can't be part of everything. You can't do singing, dancing, and drama, everything there. And then you also want to do academics. So it may not be possible. Sports is little difficult because sports, when you are in the sports itself, would take a major chunk. A match would take so much of time there. There you will have to possibly time it a little better. But yes, it is difficult, but then you should understand that's what you have to choose one or two of it and then pursue that. Because primarily your intention is to finish your MBBS. So you want your MBBS degree. Academics is the primary point there. Along with that, if you try to personalize and choose certain things, always there is going to be time. You can't be reading all the time. All these things help you to relax and then get back to the subject also. So you should identify one or two or some and then try to invest on that rather than everything.
Thank you so much, sir.
Let's take the next question from Samya. Samya, please uncam yourself. Right.
Good evening, sir. So
Good
my
evening.
question is, what does toxic culture in medicine mean to you? How have you seen it show up in your training days, and how to handle it?
We are
This is
humans.
something, right? So this is something many of us feel. So
So
something that
that's
we would share.
there. It's humans. We are humans reacting with humans. So it's how we react to it and how do it. It's a part of human nature. Somebody dominating somebody wants to put somebody down. That's a part of human nature. A particular person is like that. So it is there. Some places it might be more. Somebody who is at a post above you who can influence. Then it might be a little difficult. I won't say that it is not there. But yes, please remember one thing. It's 5 years of your MBBS or something and 3 years of your postgraduate. We have to finish it. That's something. We require to finish and get our degrees. I know sometimes it might be difficult in some places. Yes, I do agree that there are places where the levels of toxicity, so-called toxicity, is much higher. But otherwise, I think our main motivation, yes, we do our things proper. And if it goes above a particular level, definitely report it. Do not keep quiet. I would say maybe in our generation, people would think that we would be penalized for doing that things, and people were not afraid of. People were afraid of coming out and saying such things. But I think now it's open. But what I feel now, it is like over exaggerated. Even the smallest thing has been reported as toxicity, which is not right. Our times also was tough, but then that does not mean that we are what we are today because how we went through it. So whatever you face, whatever you experience in this years, when you are a undergraduate or postgraduate, that adds on. It gives you a more, it makes you complete in many ways. You will be able to face a lot of difficulties on your own later. So I won't say toxicity is needed, but then do not label everything as toxicity. That's something that is happening badly now. Every small little thing is labeled as toxicity, which is wrong. But yes, if it is definitely a toxic, please don't keep quiet. Do report it.
Let's
Hope I
take
was.
Yes, sir, you're audible. So let's take the next question from Pushpreet.
Good evening, sir.
Good evening.
I wanted to ask if there was a mentor or there is a mentor or a teacher who had a major influence on your career, and what did you learn from them?
I think if at all somebody, I think I had as I told you earlier, my botany professor, Professor Nagalakshmi. She's the one who said I should join medicine. So definitely I would name her first because I was not seeing myself in medicine. If she wouldn't have told me that I could do it and I could try it was difficult those days, financially and all those things also for a first generation doctor to come into a field of medicine. So I think I would always remember her as a great teacher and the one who pushed me a little. I had good seniors, quite a lot of postgraduate seniors who were really good teachers, and I have learned from them. So, basic thing that I would always want to, what I learned from them is if I know something, I should give it to the next person. As a senior, I would like to teach my junior these things because I have learned and I have been told this. So, what is given to you should not remain with you. It has to fall further. You have to do it. And all my books are just testaments to the simple fact that what I know should not go away with me. It has to remain for. Whether it's useful or not is a separate thing, but then if something I feel is useful, should go to the world.
Rightly said, sir. Okay, so now, yes, we have a question. Please unmute yourself.
Hello, good evening, sir. Sir,
Hmm?
I have just entered the final prop. What should be our approach in reading and revising medicine efficiently, as it's considered as the most vast subject of the prof and the most important one?
You're already in final year. You're already in final year now. That's what you said, na? So
Yeah,
please
yeah.
remember, medicine doesn't start in final year. That's something that should always remember. Medicine is a subject that you have to start it from the earliest. As you said, medicine is a vast subject, and medicine, you would see patients right from your second year onwards. So you would have learned through the process. So what for the junior students, I would like you to understand that when you go to the wards in your second year or third year and you see cases, please read up about that cases then and there itself. So that is what you're supposed to do. That's what helps in the final year. Now, once you're in the final year, hopefully you've done some part of it. You've read certain theory part at least is a little okay with that time. You have to concentrate on the theory part because you're going to give the exams at the end of the year. Also the clinical part. So whenever you're on clinics, I would always say do not miss your clinics because patients, your case discussions, that teach you much more than theory books. So theory you can read, you can go through your videos, whichever platforms, and you can learn there. But the bedside, how to palpate organ, how do you do elicit the reflex, all those things happen in clinics. Concentrate on your clinics because in your final exams, they will expect you to demonstrate certain things, and unless you practice it, it won't come. So make sure you use your clinics very efficiently. Make sure you ask your doubts and improve your clinical skills. That's something that you should do it as you're in the final year and medicine is the subject which is going to be assessed at the end of the year. Make sure you improve your subjects, your clinical skills. And yes, do study the theory, and that's absolutely needed now. But for the theory, I would always say start early. Start early. Do not keep it in the till the final year because your third year is relatively free now, so you can study well in third year itself. But improve your clinical skills. That's something that you have to remember.
Right, thank you, sir. So, Tejas has the next question. Go for it.
Good evening, sir. I wanted to ask if you ever struggled with comparing yourself to your peers, and if yes, how did you cope up with it?
No, but that's but natural. All our marks are uh, on the notice board. You know who has done better than you, who has not done better than you. So that's natural. So competition and things are very, very important because if you think that you are the only best, then you will not improve. But always keep yourself as a mark. Yes, you would want to be in the top 10 of the class or whatever academically, but keep yourself as a mark and improve on yourself. If you're doing better from what you were earlier in the whole, that should be enough. Because as I told you, people get the medals and all, but finally in the long run, it's how you have learned the subject and how you practice it that becomes more important than the medals itself. So keep the mark as yourself and you keep improving on that. And if you do that, then obviously you will be in the better than the rest of the class. It is needed. Competition is needed. Otherwise, you will become very sober and you will think that you are the only best. So competition is needed. It has to be healthy. Yeah, that keeps you going.
Sure, sir. Thank you, sir.
Harsirat has the next question. Please unmute yourself. Right.
Good evening, sir. My question is, what role did friendships play in helping you survive medical college? And how should students choose right people around them?
That is the most important, I think, the best question at all. You should always remember, keep your MBBS friends. That's what the group of friends that you make in this 4 years or 5 years. That's the one which helps you a lot in your future. Whenever you are going low, whenever you are, possibly facing certain difficulties, medical difficulties or, personal difficulties, when you're low, your mental status is not proper, friends are the ones who are needed. So all students, for that matter, any branch, keep your friendships. Have a small group. I won't say that you should be friends with everybody. Now, how to choose, that is left to you. That the criteria is not there. People become friends, and they remain friends for life. So that's something that you should always remember. Keep a group of friends. You should become friends with somebody, and you should help them in many ways. Not only academically, more on the personal level. When they are high, be celebrated. When they are low, make sure you give them the shoulder. So it's very, very important.
Sure, sir. Thank you.
Perfectly said, sir. So, Vidhi has the next question. Vidhi, go for it. Please unmute yourself, Vidhi.
Good evening. Hello. Am I audible?
Yeah, you're audible.
Okay. Good evening, sir. I wanted to ask, how important is it for a medical student to ask for help, and did you face any difficulties in doing so as a student?
It's absolutely important. That's something that maybe our generation, we were a little more, what should I say? Maybe a little more timid. We wanted, we didn't want to get the problems out. We wanted to keep in our side. And we have seen people suffer from that, and then eventual, bad outcomes happened of it. So what is very important? Yes, if you need help, whatever be the help, be it medical help, be it, mental help that is needed or social help that is needed, make sure you ask it. Do not keep it to yourselves. That's something very important. That's why I told you just, I think, with the last speaker, make a small group of friends who are very cohesive. They can understand you. You don't have to tell them. They will understand it before that. Always ask for help. Academic, definitely don't hesitate. If you require any academic help, questions, write out, ask it. Every professor would be happy to answer your thing. Other than that, be it emotional, all those things also, make sure you come out of it. Do not keep it to yourself. That's very important. Ask for help.
Okay. Thank you.
Jugad, you can take the next question. Please unmute and uncam yourself.
Good evening, sir.
Good evening.
My question is, despite of the academic aspects, what other qualities did you acquire along your journey which helped you shape into the person that you are now?
Yeah, I think other than the academic, yeah, that's what we discussed about the patient care, the compassion, the groups of friends that were there who would help each other. And learning is a process of teaching. You learn by teaching. So that's something, always, whatever you learn, whatever you read, make sure you teach it to your juniors or tell it to your juniors. It helps you to recollect a lot. It helps you to remain a lot updated in that way. And very important, as I told you earlier, medicine is changing. Remember that and keep updated. So these are the qualities that you should go around. And the word for medicine is compassion. Do maintain it at all processes, and see others. Others might be good at certain things. Learn from that. Envy is very easy. To become envious about somebody else is easy, but to learn from that is important. You can be envious, but learn from that. What is good in each of them? Make sure you try to imbibe some of it. And if you identify something is wrong with you, try to leave it as fast as possible. Any character, any behavior, any habits, try to undo it really fast.
Thank you, sir.
Manmeet, you can take the next question.
Good evening, sir. Sir, I
Good evening.
wanted to ask how did you balance being a medical student with still being a normal human being and having interests, emotions, and personal space?
It is difficult, as a student, it is okay. But when you practice medicine and you see a lot of patients, you see death that you see very closely, you see a lot of diseases which are, have bad prognosis. It's very difficult, to become normal. So it's not easy to maintain your normalcy. It requires a lot of, insight into that and what it is. You can't carry whatever you see in the hospital to the house. Your mood has to be different. You can't carry what is there in the house to the hospital. So it requires a lot of extra effort from your side. It will come by practice. Initially when we declare deaths and all, it's very difficult for us when you're possibly in your first year of your post graduation and some death happens and you have to go and counsel a patient. By standards for that is difficult. But as now maybe people consider us as a little inhuman because we have seen so much of deaths that we don't emote that well. So we have to keep our emotions a little covered. The aggression that we have, many times we feel sad, bad, the people feel disrespected. All those things we should keep it a little inside. Sometimes it might come out, but then we should have a strong weight on how the emotions come out, what should be shown exteriorly. That's very important for us and very important. You have to balance. You should not carry whatever it is there, back home. You have to keep it. That comes by practice. Sometimes it's difficult, but then it comes by practice.
Thank you, sir.
Devant, you can take the next question.
Good evening, sir.
Good evening.
Sir, during your time in MBBS and hospital hours, what small daily habit did you have to keep you stay grounded during those most stressful hours?
I think as an MBBS, something which is vast, we do not know majority of things, what is happening around us. And when you go to the wards, you would not know much. I mean, what's happening to the patient and all. So that itself keeps you grounded when you see that things are happening and you do not know what's happening there. So that awareness is very important. Okay. But as a postgraduate later, you know about the disease, you know how the patients are behaving, how the patients will improve or not. You generally get to know the pattern that is there. But what is most important is, however well we know the theory of it, however well 100 patients of this I've seen, the 101st patient will behave differently. So that is something that all doctors should always understand. You might do 100 procedures and get 100% result, but the 101st procedure can go totally opposite. So that's the uncertainty. I'm not saying it is like an uncertainty of emptiness, but then how a particular patient would behave with a particular group of symptoms is always different from the patient which you have seen earlier. And that is something which keeps medicine alive. You might say that this patient with so much of complications, so much of lab reports will go down or will go improvement, and totally the next day it will be totally different. So the individual patient behaving differently for a particular disease itself keeps medicine going. So the uncertainty of how a disease will behave, that's what keeps you grounded. If you know that, if you feel that everything has to go by yours, you do this procedure, this thing, this would happen, then you will be flying. But the basic point that we still do not know what's going to happen tomorrow and how the disease may manifest, how the disease may improve. That is the point. If you remember that, you will always remain grounded. And remember that that's somebody big who knows better than you. You are not the et all. Somebody can do things better than you. Somebody can do things much, much better than you, even if you are the best in that. So if you have that in your mind, definitely you will be grounded.
Thank you, sir.
Thank you.
Yes.
Good evening, sir.
Good evening.
Sir, being at the end of the final proof, So I just wanted to know, should we complete the syllabus of all subject first or start giving GTs?
You can never finish a syllabus. That's something that you should always remember. If somebody comes and tells me that they've finished the syllabus, they've just read it. It is not finishing. So subjects never end. So it's important for you to know that there is a fixed time. Your exams are at particular time. So you have to finish whatever is needed for that. You should always know how the pattern of the exam is, either by giving grand test or whatever you're saying. The pattern is important. You not knowing the subject alone, you should be knowing how to write it also. If you know everything and still you're not able to finish that paper in 3 hours, that's going to be a bad thing. So you should simultaneously do that. So you should appear for the exams. You should try to improve your skills of answering the multiple choice questions or the short answers or the long questions. Timing it is very important. Syllabus finishing never happens. That's a truth.
Thank you, sir.
Okay, so time's running short. We can have the last question from Mehtab.
Good evening, sir.
Good evening.
I wanted to ask, how do you deal with academic failure without losing your confidence?
I am not able to hear you clearly. What was the question?
So I said, how do you deal with academic failure without losing confidence in yourself?
Okay, how do you tackle academic failure without losing
Yes, sir.
confidence?
Yes, sir.
Important. See, these are all new subjects that you'll come to. When you come to the second year, you'll have pharmacology and all those things. When you come to medicine, you might know everything, but then when you write the paper, you don't get the marks. So that's very normal, very normal. Let's take it like that. Maybe not like an engineering subject where you write a theorem, you should get the mark. Or in your 12th, you wrote everything, you will get the full marks. That's not going to be. Your medicine is not multiple choice questions. You know the right answer, you'll get the marks. No. Sort of subjective element is there, and then when it comes to clinical correlation and you write a question based on clinical correlation, the marking may not be that what you expect. So failures are bound to happen, but please remember it's a process that we are learning through it. As far as we know that there is a failure, we identify the cause of failure. If you have put your full effort and then possibly the question papers came a little tough, then you know the reason there. Understand what the reason was. If your effort was less, you understand that and improve on that. So failures are, as it's told, the stepping stones for success. Understand the failure. Do not live in the failure for long. Yes, you can lament for a few days. After that, you have to get up and then move forward. Learn from whatever you do, whatever you have achieved, learn from it. Even from your failures, learn from it. Failures teach us much more than what successes do. Why somebody does well. You always analyze that. So never be remaining in the same post. Always try to learn from it and move forwards. Life is always like that. Today's failures does not mean you would be the most successful person in life. Subjects, exams and all is not so materialistic when you see on the long run. On the long run, it's how you take care of your patients and how successful you become is how you're related to the patient. That's how it is going to make success. When you meet your batchmates after 25 years, possibly, after you're passing out, you would be much bigger practitioner, possibly, though you might not have got the gold medals.
Thank you so much, sir.
With that, we wrap up the Q&A session. Now, I would request all the attendees to please uncam yourself so that we can take a few pictures.
Kanishka, I want to thank sir.
Yes, ma'am.
Yeah. Hello, Dr. Archith. On the behalf of SGRD and SGRD SIGN, I'm Dr. Neha Uppal, Professor, Department of Biochemistry. I really want to thank you for motivating our students. It was really an experiential learning session for them. And for them also, and for me also, it was a right back in time. Me being from 2K1 batch, so I could correlate to the things that the lack of UG research during those times. Thank you so much for motivating our students. And I would just request you to highlight the importance of clinical history from them. Having it from your side, they would be imbibing it better. Please, sir.
Something that I think patient teaches you a lot, much more than books. So listen to the patient. The history will be told. The diseases, all the diseases which are known to mankind follow a history. standard history, which is not given in books. Older books had it. Now books are all small. They are manuals and then they are guides. They don't mention that much. Only question answers are there. Every disease has a natural history. We don't know it because we don't read it. The patient knows it because he suffers. So he knows what the disease is, how it manifests, what came first, what came later. And every disease has a natural history. And the only person who can teach you is a patient. So spend good time, speak to the patient. That will teach you the compassion, that will make the patient comfortable. Even if you're an MBBS student, if you go and speak to a patient, you're not, they will feel more comfortable to you rather than maybe the treating doctor, because you spend more time with them. And please remember, there is no alternative for clinical medicine. No books can replace it. You have to speak to the patient and you have to elicit, and then you can get the science. So history is most important, which is grossly lacking in the present curriculum as well as in the books. It won't come in books because it is individualized. It's quite unique to a particular disease. So you have to speak to the patients and get it.
Thank you. Thank you, sir.
So now, all the attendees, please, can you uncam yourself? Thank you so much. So on behalf of the entire team of SGRD SIGN, I extend our sincere gratitude to you, sir, for sharing your time, experience, and insights with us today. Your reflections on medicine, resilience, and growth have been both inspiring and deeply meaningful for our students and attendees. Sessions like this truly embody the spirit of Deep Dive series, learning that goes beyond textbooks and into the real life. Thank you for engaging with our attendees so generously and for guiding us with your wisdom. It was truly an honor and a privilege to host you, sir, today. Thank you so much, sir.
Thank you very much. All the best to all of you. Well, God bless.
Thank you, sir. Thank you so much for being with us, ma'am. Thank you so much.
All the best, all of you. Keep
Thank you,
going.
ma'am.